As many of you know, because we've had conversations with you, it's been incredibly important to both Senator Stern, myself, and our colleagues from across the San Fernando Valley to convene a session like this to answer a number of remaining unresolved questions about what are we to do as the Aliso Canyon facility remains open, remains a concern to the entire community. What are we prepared for in terms of an emergency response were there to be another blowout? Was the response across a number of sectors, governmentally and community-wide, sufficient to have protected the community? And we know the answer to many of those questions is no. And so how do we solve it going forward? So our hope is to get answers to some of those unresolved questions, to continue to move this community towards progress, towards safety.
Public health, I will tell you now, did not receive sufficient cooperation from the gas company throughout this response. Now, while the cooperation was earnest at first, soon thereafter there was a marked lack of cooperation from the gas company, bordering on belligerence and ultimately deception. And the public health department was unable to obtain critical pieces of information that we repeatedly requested from the gas company. And I'm no engineer, but we're looking at a process that seemed to have no efficacy, but certainly jeopardized the safety of the community by the oily mist that got spewed out with all the attempted kills that were unsuccessful. And so that led to oily residue on people's homes. It may have led to the translocation of chemicals, metals, and others into homes that we did in a limited environmental investigation. And we've requested the database of homes that were cleaned or affected or tested by SoCalGas. Not a word on that. We asked for comprehensive chemical testing of the air starting in November 2015, as soon as as soon as it became clear that this was going to last a while. That was not begun by SoCalGas until January 2016, well past the peak of the event. So without these critical pieces of information, public health did not have enough data to fully characterize the potential risks to human health.
Thank you, Doctor. And I appreciate the thoughtfulness that you have in now saying that the county Department of Health finds this facility to be unsafe, too unsafe, in fact, to operate and needs to be shut down. And while I understand the limitations of dealing with SoCalGas throughout the course of this emergency, I can also tell you that based on data that I found that was publicly available, the Department of Public Health took way too few actions, was woefully insufficient in their public health response. We know that the leak started on October 23rd, 2015. On November 7th, the AQMD issues a notice of public nuisance to the facility, noting benzene at 7 times a reasonable and healthy level. We know that on December 17th, as presented to the Board of Supervisors by Interim Director Cynthia Harding in a report, as early as December 17th, there was reports of oily residue across the community on people's cars, on their homes, on things in their yard. At no point between those 2 points did the Department of Public Health issue a warning to the community to even be wearing respirators or to leave the community for their own safety.
During the incident, we learned a lot, and we would do things differently next time. I think we were all a little slow to respond to the seriousness of the event. I know I was up here a few days after the leak was discovered. I always thought that calling it a leak was a misnomer from the beginning, because as you got close to it, it sounded like a jet engine. It didn't sound like a leak, okay? It was tremendous pressure coming out of the ground there. I think early on we were providing advice to SoCalGas. Public Health was with us, but we didn't go into a unified command early on. And if we had another incident like this, that would be something we would do early, where we could bring more resources to bear, more safety to bear, and move the gas company along maybe a little quicker.